Hey there! Did you know Kroger always gives you savings and rewards on top of our lower than low prices? And when you download the Kroger app, you'll enjoy over $500 in savings every week with digital coupons. And don't forget fuel points to help you save up to $1 per gallon at the pump. Want to save even more? With a Boost membership, you'll get double fuel points and free delivery. So shop and save big at Kroger today. Kroger, fresh for everyone. Savings may vary by state. Restrictions apply. See site for details.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hello, Jess.
All right. So today we are going to talk about what you should have in your labor bag. The clock is ticking, so let's get to it. All right, Dina, what are some of the essentials?
So you want to start thinking of packing a bag around month 8, since you always want to be prepared. And first things first, you need to pack important paperwork such as insurance cards and IDs, an emergency contact list, and any other paperwork or medical record your OB recommended you bring, so your medical team can have easy access to all of that. In fact, I remember my OB wanted me to have on hand a copy of important medical information, such as my HIV status and my Group B strep status and recent vaccine histories, such as Tdap and MMR and COVID vaccines, and now the new RSV vaccine. Also helpful is to bring in a list of medications you are taking. And if you have a birth plan, pack that away too. Of course, if there's any information you want to have the pediatrician know about, like any abdominal ultrasound results, have that info handy too, just in case nothing gets lost.
All right, that is all super helpful. What should we pack for mom? What should mom pack for herself?
Yes, of course, most importantly. So everything to make you comfy, basically. So slippers and socks that you can wear around the room that are not slippery because we don't want any falls. You want flip-flops or shower shoes that are very comfortable for you to wear for your first luxurious shower after giving birth. You want to do a robe for after the shower or over your hospital gown. Of course, comfy PJs and nursing pajamas, changes of underwear, nursing bras, and an outfit home. And I remember, too, being so very swollen on the way home from all the fluid I got after my C-section that the jeans I wore to the hospital didn't fit me on the way home. So you want to think about wearing things that are more comfortable on the way home, like a stretchy pair of pajamas or more comfortable shoes, such as like clogs or something that are open-ended in case you're a little fluid overloaded.
I had a C-section. Well, I had an emergency C-section, and then I had a repeat C-section because my hospital wouldn't attempt VBAC. But I just remember leaving there. I was so swollen. There was no way I could wear any pants or anything like that. But specifically, I bought the softest cotton underwear that literally they basically like went up to just underneath my boob, like they were like high-rise underwear, just because I was so scared about that elastic band cutting me where the
mesh underwear. Yes.
And I'm not gonna lie, I still have those underwear, and they are my most comfortable. I now typically wear them.
Are you wearing them now?
Honestly, let me take a look. No, I am not. But this weekend.
Also, as comfort, you want another recording. Take extra long charging cords, a camera, and anything you need to relax yourself, like music and magazines, a favorite book, an iPad to catch up on news, or watch your favorite trashy shows, and of course, a comfy polo. Anything for comfort.
Absolutely. What about toiletries?
Yeah, so many hospitals will provide shower supplies, but I'm picky and I'm a little bougie, so I love having my own soap and my own face wash and facial wipes, shampoo, conditioner. You also want to think about maxi pads, lots of moisturizer, Vaseline, and chapstick for dry lips, toothpaste and toothbrush, deodorant, comb, hair dryer, makeup. I brought all that because there's, a lot of hospitals offer professional baby pics at the hospitals, and I wanted to look my best with my new baby. Also, don't forget your glasses, contact lenses solution.
What about snacks? There are certain things that obviously we couldn't eat during pregnancy. I don't know. Any fun snacks that you recommend?
Yeah. So before you deliver, you obviously talk to your doctor because, they don't want you to eat a lot of times before you deliver. But afterwards, afterwards, pack plenty of comfort foods and drinks to get some energy back after all that pushing.
And I'm not going to lie, my husband definitely did bring me sushi.
I had salami. As a good Italian I am. My husband got me salami and cheese.
I love it. All right. Last thing. What about baby clothes for the new little one?
And so hospitals may have policies on what a baby can wear. So check in with them first before you bring a ton of outfits for the baby. But as a pediatrician, frankly, when I walk in the room, I don't want to see a baby bundled up in a ton of clothes and cute bows and all that stuff because it's difficult to see them and examine them. And you want to, see the baby and how they're breathing and, make sure there's no trouble right away. So often the baby will be in the hospital just in a onesie and a swaddle blanket, which is all they really need now from in the hospital, given that they spit up a lot and there's frequent diaper changes in the beginning, along with multiple exams and vital checks. And for going home, though, we recommend, something like a onesie or PJs or cute outfit over the onesie. And if it's cold outside, a warm suit or bunting over it. And remember always to have a car seat ready, as well as the base properly installed in your car seat for the ride home.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
As a longtime foreign correspondent, I've worked in lots of places, but nowhere as important to the world as China. I'm Jane Perlez, former Beijing bureau chief for the New York Times. Join me on my new podcast, Face Off, U.S. versus China, where I'll take you behind the scenes in the tumultuous U.S.-China relationship. Find Face Off wherever you get your podcasts.